All right, welcome back to another week of the NatRevMD Podcast. I am very excited to have with us this week a physician who has built an amazing practice. Even though it's been hard work, he's really built something that I think he should be proud of if he isn't already. So with that, I'd like to introduce Dr. Ahdoot, who's doing orthopedic surgery. And really, he just didn't open an office. Like, you look at his reviews, he has built a practice that patients want to come and find him and see him and have had really positive experiences. So I feel like that's both, you don't see that often, right? You see that you built a practice that's financially viable and has a ton of volume, but also a practice where people actually generally love to see you. So with that, welcome. Thanks for being on the show.
Thank you, Heather. Happy to be here.
I'd love to hear just your background. I mean, obviously orthopedic by training, but tell us a little bit about your training and kind of maybe those first few years out of training.
Yeah, so born and raised in Southern California. I was very honored to be at a training program at a county facility for my residency. And for those of you who don't know, a residency program is where you get your training. So at a county facility, you're considered a tertiary center where people who are uninsured or jailmates who are funded by the government, they get shipped to the hospital for training. So we dealt with a lot of trauma, a lot of different kinds of pathology, and I was put in a position where it was a lot of independent work, good and bad, whatever it may be. It put me into a position to be very confident in my abilities and be confident in my tasks because we were left to take care of the patients with minimal to no oversight at some times. But more often than not, the insight was there when we needed it. But it allowed us to strive for perfection because everyone was counting on us. So I think I had 5 years of residency in a county facility, which essentially made my skin thicker, even more so than what residency did, but allowed me to essentially join a private practice, grow my own private practice, and have the confidence to take the next steps and initiative to move forward. I don't know if I would have had that if I didn't have that training.
And so when you finished residency fellowship, did you go out immediately and open up the practice, or were you employed for a period of time?
Yeah, great question. I was looking at both options, but when I graduated, it was the midst of COVID.
Mm.
So not a lot of people were hiring, and I was kind of forced to go into private practice because I couldn't find a lot of jobs, at least in the areas that I was looking for, which was a blessing in disguise because I knew my personality. I knew I wanted to be in private practice, and that was kind of the initiative for it. So I just delved into private practice. In school, they don't teach you about the business aspect, about the insurance. I figured, oh, I'm going to knock on the door of the hospital and say, oh, I want to work here, and they're going to welcome me with open arms. But no, that was definitely not the case. They questioned me like, who are you? What are your credentials? What do you bring to the community? What do you bring to the hospital? So it wasn't like that. So, I had two kids at that time. I had literally no income and it was pretty scary. So whatever I could do, I drove literally 100 miles in the beginning just to take call at different hospitals to grow practice and grow some revenue.
And
And I did. I did whatever it took.
did you start then knocking on the doors of the hospitals first, or did you kind of hang a shingle, so to speak, from a clinic perspective?
No, I hung a shingle at the clinic, and I would have nobody banging on the doors and saying, "Oh, I want to see Dr. Duke," because they didn't know who I was. So once I created my shingle, I got my licenses and all that stuff. I went to hospitals and say, "Hey, I'm happy to take call. I treat children. I do all this stuff. I'm trauma heavy. I had a lot of confidence to take on a lot of different cases. And then from there, one hospital turned into two, three, four, five hospitals, and I was taking five hospitals a month of call, and I was literally driving all over the place.
And has that scaled back now that you've grown from a volume perspective in terms of like the breadth of how far you travel?
Yes, absolutely. It's scaled down, but I have a sickness. I can't completely let go of it because I enjoy it,
Yeah.
part of me.
Yeah.
But at one point,
I think that's all of
yeah.
us physicians. We're kind of overachievers in general. And so even though we've hit this moment of success, you keep pushing.
Yeah, it's a good question that you say overachiever. Yes, it can be a side of overachiever, but on another aspect, I have my own private practice. When an own private practice comes its own issues, right? You always worry about the rent, you always worry about the overhead, you always worry about, the payroll for your staff, right? And in medicine, as you know, reimbursement is going down every year. And it's not about 100, it's not about $10, $20, about 10 to 20% of your income. So that's a drastic thing. So, we work really hard, not because I'm worried about right now, but I'm worried about what next year will hold, right? Am I able to provide for my staff? Am I able to, continue hanging a shingle, right? Um, so the hard work I do right now isn't for today because I'm happy today. I'm comfortable today. I'm blessed for today. But what does next year hold? I don't know.
Yeah.
And I don't want to ever be caught with my pants down, running around, figuring out what to do.
Yeah. And what would you say, we have a lot of listeners who are either starting private practice, have started them, where they come to us, they struggle with building volume. What would you say
Yeah.
is like those? I mean, it sounds like driving around to hospitals, knocking on doors. What would you say either that or other
Yeah.
strategies helped you get patients to know who you are?
Good question. It's very hard. I still deal with that every day. But the biggest and most important thing is, as a physician, you're selling yourself, right? So when any patient comes in, you got to give them some TLC. You got to show them that you're confident. You got to tell them, A, B, C, this is what's going on. They're not coming, they're not necessarily coming to chit chat with you, but at the same time they are. So you have to give them the reins to chit chat. But while you're chit chatting, you have to give them, hey, this is the scoop. My wife always tells me your patients, they're not there to be your friends, so don't sugarcoat anything for them. So tell them straight up, tell them what they want to hear. Maybe it's not what they want to hear, but you're not their friend, you're their physician and they're looking for you for guidance. So, give them some TLC, but at the same time give them some advice. So one, you have to sell yourself being confident. One, you have to be patient, you have to be educational with them. Okay. And also, if I take call in the community, that grows my name. I still go to the private practice offices and introduce myself. And this is what I can do. Happy to take care of your patients. And I still text them. Thank you for your referral, right?
Good.
You stay in contact with them, right? What I did when I first started practice, I sent them letters, but those letters, I don't know what happened to them. I didn't really create a relationship. So I'll text now. I don't care if they don't respond to me, but at least, I'm initiating something like, hey, Dr. Jones, thank you for the referral. I saw him. We're going to see him back again in 4 weeks for this or that.
Well, and again, that makes them think about you the next time, right? Even if they
Yeah.
don't respond,
Yeah.
they're like, oh, that was really nice. I got that response back. I know that, Mr. Jones or whoever was taken care of. And so even though you may not get that initial feedback or that immediate feedback to say, yeah, that worked, or they're going to send me more, from your
Yeah.
patient volume that as that has increased, right, that a combination of those activities are working, because otherwise you wouldn't be where you are now.
Yeah. But most importantly, you have to cater to the patient, right? So in this world, it's all about customer service. Amazon, why are they so successful? It's about customer service, right? So when these patients come, whether they want to talk to you for 1 minute and leave or when they want to talk to you for 30 minutes, you have to give them what they want, right? You got to treat people completely differently. There's no textbook or algorithm in doing so. If you feel and you're reading a patient and they want more attention, you got to give it to them. If you're reading another patient and they feel like, hey, surgery is not for them, then maybe, take it easy on talking to them about surgery. You got to feel them out, right? If I talk to every single person who walks in the door about surgery, I'm going to turn off 70% of patients that walk in, right? Because you got to feel them out, whether it's culturally, whether it's, what their expectations are, whether it's their job, whatever it is, you got to feel them out to see how you can better adjust them, right?
I like that. Yeah. And I think it is part of the softer side of medicine that is a reality. So
That's the art of
it
medicine.
is.
That's literally the art of medicine.
Yes. Now you finished training, obviously med school residency fellowship, got out. Do you feel like the healthcare system, and I'm kind of prompting this, I probably know the answer, you probably know the answer, but do you feel like you were prepared to open private practice? Uh, if so, or yes or no, and why not?
Yeah, that's easy. That's no.
Yeah. Again, I knew the answer to that, but
Yeah,
I think I
yeah,
mean, it was one of the reasons why we started our company. It's one of the reasons why we started our podcast, because I don't feel like we're prepared for this. I was pushed into healthcare business side on day one of my after training. Some I knew, some I didn't. My family comes from healthcare administration, so I felt like I was around it, but it's still, I was kind of pushed into something. And it sounds like even though you were doing the pushing yourself, right? Like you chose to go into
Yeah,
private practice, you're having to figure it out as you go, right?
yeah. I mean, to be honest, medicine, right? But medicine doesn't correlate into how to speak to patients, be confident when you speak to them, give them options. It doesn't teach you that stuff. It teaches you, you read something and they expect you to go, verbatim and tell a patient that. But no one walks into the door and says, "Hey, I'm on textbook page 66. What are you doing for me?" Right? So, in addition to learning to become a doctor, right? Learning to become someone people are looking up to for advice, you got to learn the business aspect of it, right? You got to learn about how to treat your employees. You got to learn about payroll. You got to learn about malpractice, disability, um, EPLI insurance, for example. You got to learn about all these different things at the same time. But most importantly, you're first learning how to become a doctor, right? So on your own. Yeah, yeah, yeah.
Hmm. On your own, on your own too, because you don't have
Yeah, you
anybody. I
got to learn
mean,
about
maybe the hospital
billing,
you do
right?
it
If you don't
in
bill
clinic,
accordingly, you don't
it's
get
you.
paid, right? And as a doctor, no one thinks about getting paid. You think about, oh, being a doctor, but you got to make money to pay your staff, to pay the EMR system. You want to be at the hospital, you have to pay dues at the hospital, right? You got to pay all these things. My first, I don't know, maybe year in practice, I was literally in the negative. I was red because I was just spending for marketing, spending for licenses I had no idea I needed to get, this and that, right? And the money wasn't coming in, but I was building. I was building a reputation and building all these things. So in the future, when patients want to come in, I have access to that stuff. No one teaches you these things. I'm still learning myself 3 or 4 years into it. No, it's just
And
me
did you have a
figuring it out.
mentor at all, or is it just you figuring it
Yeah,
out? Figuring it out.
yeah.
And you know, you have a family, so you're married, you have kiddos. Um, you know, did you have a good way, or do you have a good way, right? Even now today, to balance those. I mean, because it is hard in the beginning, and you are fighting for covering the mortgage and the staff and the all the things.
It's a
Like
great question.
how did you do that personally, or are you still trying to figure that out?
Uh, it's a great question. So life doesn't get easier. Your job doesn't get easier, right? What you become better at is maximizing your time or your efficiency, right? So maybe in the beginning I saw 6 patients and I was overwhelmed and I'd get home at, 5 p.m. Now you see, more patients and you're still doing the same amount of work, or you're doing 10 times more work, but you're leaving in the same amount of time. It's because you become more efficient. So in the beginning, my wife understood that priority was, to provide for the family because we were starting up. We had literally nothing and no support. Thereafter, things started to change. We had more children, more expenses, right? So I had to work harder, but also I knew, and this is a personal thing, I wanted to be more available for my wife and my family, right? So I prioritize that. I work really, really hard during the day so I don't have to work later into the evenings and go home and spend time with my family. And when I am home with my family, I compartmentalize myself. So I'm home, phones off, it's in the corner. I'm 100% attention to my kids, my wife, and whatever the needs are of the home, right? And when I'm at work, it's I don't want to say I neglect my wife, but she knows that, hey, I'm here to do work. Unfortunately, I'm guilty, of not being perfect,
Yeah,
but we always strive to be better in a sense.
we
Um,
all are.
so yeah, that's always a dilemma on like how to become more efficient and how to have more time with family. So some things you learn to delegate to become more available, right?
Hmm. Yeah,
Yeah,
that's what they say. It's not about life work balance. It's more of just priorities at the time, right? So during the day, 7 to 5 or whatever it is that you work, that your priority
yeah,
is work. And then
yeah,
after 5, as
yeah,
long as you're not on call, that your priority is kiddos and wife and,
yeah,
homework and all the things that come with babies. Oh, you may not
yeah,
be at all
yeah.
homework yet, but
I look on maybe
it's coming. So,
I
and
honestly,
they do math.
I look
They do
forward to
math
it.
different
Maybe
now.
not my
So
wife so much, but I
I'm
look
just
forward
putting
to
that
it.
out there.
Yeah,
Yeah. I will have to say homework is fun. I mean, again, we were doing the Punnett Square with my son this past weekend.
Yeah,
He's
yeah,
seventh
yeah,
grade,
yeah,
so and that was actually fun because it was something
yeah,
that you know
yeah.
we know very
Yeah,
well. So I'm like,
it's
okay, this
nice
one
to
I
see
can
how
work
them
with.
grow, what they're actually learning and obtaining, right? It's crazy. These kids, my daughter, I'll tell her one thing, and it's the next day she's excelling in what I just said, and I'm like, wow, that's bizarre. And then my other kid, I can tell him the same thing 20 times, and he's just like oblivious to it, you know? They're all so different. Yeah, they're all so different. And it's a
They're
blessing
all
watching
different,
them
right?
progress and
They're all
matriculate,
different.
whether that's
They're
in
all so
school
different.
or social atmosphere. That's another reason why I joined private practice, because if my daughter has a ballet recital, I want to be able to tell my staff, hey, cut it short today, I want to go. Right. And in a real world setting, when you're clocked in 9 to 5, as a physician, it's hard for you got to request that time off like 3 months in advance. And I don't know what 3 months in advance. It's hard. It's hard to do that.
I would agree. Now, if you were to say, okay, these were the, one, two, three things that were the best things that I could have done for your practice those first few years, what would you say those are that made it successful so that you could, pay the bills, pay your staff? Like, what were those three things that made such an impact?
Drive.
Mm.
You have to have the drive. Getting into private practice is not for everyone, and I'm not trying to deter anyone for it, but you personally have to have that drive to go out and go get it. Um, if you feel like it's going to come to you, then you're wrong, and it's probably not for you. So opening up the shingle with nothing to actually hang up, um, that drove me like, hey, where are the patients? Having a family with two kids at that point with nothing, that was made me driven. Like I was like, hey, I gotta go. Another thing that was very helpful for me is I got one staff member, and that staff member did everything for me, like roomed
Is that
patients, helped
Kelsey?
me do all the, yeah. So she helped me do everything from the beginning. So we created a great relationship, and it excelled to now she's having help. She's, hiring other people to help her. But I think you have to have a team member. You have to have a role model. You have to have someone that you can talk to and grow with. And Kelsey was that one person for me, because I was going to multiple different offices, and she understood everything that I was doing, and she helped me expand and get the help that we required. So she knows my practice in and out. She knows all the things that I've done. She probably doesn't know all the struggles, because you try to keep that from your staff. But um, nonetheless, yeah. Another. So work culture is so important. You have to have a good work culture to allow it to grow. So everyone that we have in our office is interviewed by Kelsey and interviewed by me, and we all have to be on the same page. If there's one bad apple, then everything gets bad. So we want to make sure everyone is on the same accord and everyone's on the same page. And throughout the day, we're texting each other. I joke around with some of them. We go have lunch, coffee, whatever it may be, because the culture is very important. You're with these people more than your family, so you want to make sure that they're happy to be there and you're happy to see them. And yeah.
Yeah. So driven in culture and I could not agree more with you with both of those because grit or just being able to withstand hard things and just keep pushing
Great.
because it is
Yeah.
business. There's this picture of like the linear relationship of time and business, and in your brain you kind of think of it as a straight line from start to finish, up to down, which it's not true,
Yeah.
right? It's more of like this undulating, you have highs and then lows and then more highs and then lows, and that's just reality, and at the end you're still moving in that same upward trajectory for most people,
Yeah.
but it's not this like straight and narrow easy peasy thing. I mean, it is. I mean, we've had the same thing. I mean, culture is huge, and we have a team of 70 people, and culture just is more important, I think, than I could have ever imagined, because you do have one
Yeah.
bad person and it spreads like wildfire, like
Yeah.
literally. So
Yeah. That's hard to prevent, but you do the best you can. At least if you're aware of it beforehand,
right.
it's something you can really take into consideration and take it more seriously. Like if someone comes in and you're desperate for work, maybe hold off if you have to. One good person is really good and one bad person is really bad.
What is the saying? They hire slow, fire fast, and I think that's very accurate. I mean, take your time if you can hiring the right person, and if it's a
Yeah.
bad apple that's bad across multiple different things that you can't coach up, then it's time to
Yeah.
go.
Yeah, and everyone wants to feel wanted and needed, right? So, yeah.
Yeah, agree. Any last words of advice for somebody who's finishing training and hoping to start their own practice?
Yeah, be confident. Um, Research a lot, ask for help. Don't be shy, and remember these patients or whoever it is are working with you or for you. Um, they excel based off of your confidence. So you show confidence, you show grit, you show delegation power, then they'll follow your footsteps. Okay, so be confident, take the next step. It's okay to make mistakes in life. We all do. You learn from them even more so. So make the mistakes, and just improve upon them.
I like it. Well, it's been great working alongside you and your team. You've built a really great thing. You should be very, very proud of. I mean, and it's funny. I was
Yeah.
doing research for this podcast and reading all of your reviews from patients, and they love you. So you've made
Yeah.
an impact on many different patients. So you should be very
Yeah.
proud.
I try I try to show the reviews to my wife too, so she loves me just as much,
She'll get it. She'll understand. Is she in
just
medicine or
kidding.
no?
Just kidding. She's not in medicine. So, the beginning was actually a little tougher because of that. She didn't understand you're on call. What does that mean? You go in the middle of the night? Like a lot of things she didn't
Yeah.
understand. Even till this day, it's like I gotta explain, hey, I gotta go in. It's for this. Like, what do you mean? We're with the kids?
Yeah.
Um, but being supportive is very important, right? So if you guys want to go into private practice, make sure your significant other, whoever that may be, understands that you're on the clock 24 hours. And, as a physician, we do take the oath that we prioritize patients and people first, unfortunately,
Mhm. But that's also what makes
or
or
fortunately.
fortunately, right? You got to
Yeah,
have good doctors at the end of the day. That's what this is about. So,
yeah, yeah.
well, again, you should be very proud of what you've got. And it's a great practice and love working with your team. So, for the listeners, hopefully you caught one theme here, right? Work hard, have an absolute determination that nobody can deter you from. And that grit
Yeah.
and work culture is really, really important. And as always, if you've enjoyed the podcast, please share it with a friend. And I just want to thank Dr. Ahdoot for being on and kind of sharing his story, because I think it helps those of you who may be starting or getting ready to start to understand kind of the work it takes, but also, just the hope that anybody can do this as long as you kind of put those steps forward. So thank you so much.
You're welcome. Thank you for having me. Good luck, everyone.